Welcome to another episode of Brain Buzz on the Go. I'm Dr. Kimon Bekelis, your host, and today I am reaching out to you guys from Northern Wyoming. So in this beautiful part of the country, as you all know, this series is dedicated to really looking into stroke services across the country, especially in areas of the United States where there's limited resources. And this is a really fascinating area that we studied for the last few days to look into exactly how folks are able to deliver stroke care here in the setting of different geographical challenges that folks face when they treat stroke in this region. And so for those of you that are not familiar with the greater Yellowstone area or the Northern Wyoming area, Katana, Jackson, and then north of that, and the other three states of southern Montana and eastern Idaho. And so these are lightly populated areas, but they can get very heavily populated in the summer months where there's a tremendous influx of tourists with millions of people coming into the greater Yellowstone area to enjoy two of the most busy national parks in the country. You have Yellowstone in the northern part of Wyoming, and parts of it slightly into Montana and Idaho. And then you have, of course, the Grand Teton National Park south of that. And so beautiful area, but the challenges are obvious. You have very large land masses that are preserved in the national parks. And so you cannot have hospitals in those areas. Of course, you can have EMS that's available, but then obviously you have to transfer these folks out. And also you have large stretches of land. Like I said, they're preserved. There's wildlife. There is a lot of efforts to maintain the integrity of the area. So when it comes to, of course, stroke care for the people that live here, but also stroke care for all the visitors that especially in the summer months flood this area, to us, it was very fascinating to try and see how these folks are able to deliver care effectively. And so through our research, we found that there's actually three main hospitals in the region. The biggest one, and I guess the only comprehensive stroke center in the region, would be St. John's Health. And in that hospital, in that health system, they are able to deliver 24/7 comprehensive stroke care. They have the ability to do thrombectomy, the ability to do treatment of complex aneurysms, arteriovenous malformations, to do thrombolysis, endovascular procedures. They're able to do that also with a teleneurology service that we've spoken of before, and those are becoming widespread across the country. Teleneurology means that there is a robot or a computer that is brought to the bedside of the patient. A neurologist who's remote from the location is able to examine the patient and make a determination about whether the patient should receive clot-busting medications. And this, in areas such as these, where there's obviously geographical challenges, allows us to really administer these life-saving medications for stroke very effectively, very efficiently, and break those timeframes down to the absolute minimal. And then obviously after that, if the patient needs an endovascular treatment, if the patient needs somebody like us to go in through their groin or through their wrist, go up into the brain, remove the blood clot out, mechanically that happens expeditiously, and that's the only facility. This facility is also a level 4 trauma center. Obviously this is an extremely positive sign that at least regionally there is that ability to offer comprehensive stroke services, because naturally, stroke is an extremely time-sensitive disease. So if these folks had to be removed from the area, of course, there would be an impact on outcomes due to the time lost in transportation of these patients across the country. And so that's one aspect. Another hospital in the area that's a primary stroke center means it has the ability to administer IV TPA or TNK clot-busting medications, but no ability to do procedures to remove blood clots from the brain, is Eastern Idaho Regional Medical Center. Now, Eastern Idaho Regional Medical Center, in cases where there needs to be advanced care, they transfer these folks to St. John's Health. That relationship allows these patients to also receive care in an expedited manner. And then the third main hospital in the region would be Teton Valley Health. And that has a lot more limited stroke capabilities it would act more of a stabilization. We studied across the country regionalization of stroke care several years in the past, and this part of the United States was one of the areas where we noticed when we did our study that there was a tremendous need for that emergent stroke care. Of course, through our conversations with folks around here and the regional services, we also realized non-emergent neurology services are tough to come by in this region. But at least when it comes to emergent services, it appears that they have the ability here to offer those services effectively in a timely manner. Of course, challenges arise on how to get these patients to St. John's Health, especially like we discussed before, in a very diverse geography, very high mountain ranges, significant elevation, remote locations, isolated areas, and obviously all these issues come into play. And there's utilization, of course, of traditional EMS, ground transportation, there's utilization of helicopter services. Of course, these are a lot more challenging in the winter months. However, the population is a lot less in the winter months. It's more in the thousands versus in the summer months where, you know, the population can rise up to the millions as visitors come to the two national parks. But, you know, for all of us that are living in areas where we have abundance of stroke services, it's actually, this is a case study to learn how to really respond in an environment with limited resources, right? When you have limited resources, you do have to have a comprehensive stroke center, especially because this is a time-sensitive disease, and you have to take into account, obviously, the fluctuations in the population. Really, really fascinating things, but I think, of course, this area has been doing a great job in identifying this need and filling this need, of course. With that, I want to thank you, and of course, catch us on another episode of Brain Buzz. Don't forget to like and subscribe our videos. Thank you so much.